How to zap away a double chin. My name's Doctor Sanjay of Trick One Aesthetics Mayfair. In this video I'm going to be talking about non-surgical ways to address a double chin. Now, to begin with, what is a double chin? That's the little pocket of fat that we can usually see in this area here, often when we look downwards. And to some people it really bothers them, and I always think if you know or understand a problem and you understand the possible solutions, then you can always take a more informed view on how to go about treating it, if that's something you want to do. So I'm going to be talking about 3 different ways to go about treating this, and I'm going to be talking a little bit about the anatomy and how each one works. Firstly, I'm going to be talking about fat dissolving injections. So fat dissolving injections are little injections that we do of something called deoxycholic acid, and this essentially breaks down fat cells into their more basic constituents, and these get metabolized away. Now, fat dissolving injections sounds like some sort of miracle treatment, but we can only use them on certain patients, and it's very much case by case basis. With fat dissolving injections, we always need to be very careful, because when we talk about fat within the face, fat is your support and structure, so it's not a case that we can just use these injections everywhere and anywhere and it's always going to give a great effect. That's not true, because if you use fat dissolving injections inappropriately, you can actually gain sagging or heaviness in an area. So only in certain areas can this treatment be effective in certain cases with certain patients. Typically, this is going to be someone who's got a stubborn area of fat under the chin, someone who's doing all the right things, so someone who's already doing dieting, exercising, they might even feel like they're in good shape and going about things the right way, but no matter what they do, they feel like they've just got this little area here of excess fat and it really bothers them. That type of person is going to be a good candidate for fat dissolving injections. Typically it requires a course of treatments, maybe 3 to 6 treatments about a month apart, so actually it's quite a slow and steady treatment plan. It's not like a one-off treatment and zap, it's gone. For that reason, a really detailed consultation is needed to understand how many sessions you're going to need, how long it's going to take to get the result you want, and if you're even suitable for this treatment whatsoever. The next option I'm going to talk about is going to be medical devices. Specifically, the one that we like for this area is called Morpheus 8. Now, this is a medical device that combines radiofrequency with microneedling, and in effect it does 2 things. One, it reduces fat, a little bit like fat dissolving injections, but number 2, it also tightens skin. So in certain patients who might need a bit of both, this might be a more effective treatment because we can use it to treat the entire jawline and under chin area. We vary the depth of how deep we want to go to target fat more specifically. So in areas where the fat might be a bit heavier under the chin, we go a bit deeper. That sounds scary, it's not really scary, but what that means is we're targeting more so the fat and we're shrinking the fat. Then the actual skin itself also tightens and remodels over the area. So something like Morpheus 8 does a lot more than fat dissolving injections on their own, which is why typically it's a more common treatment that we would do. Very much case by case, because some patients will be more suitable for fat dissolving injections and some might be more suitable for something like Morpheus 8. With Morpheus 8, typically it requires about 2 to 3 sessions. Again, these can be spaced about a month apart, and the results continue to improve slowly over time. So with both fat dissolving injections and Morpheus 8, it's not a quick fix. This is something that's going to be a bit of a process that takes a couple of months, and the results are going to get better and better and better over time. So it's really important to discuss all that with your doctor to begin with, so you really understand the correct time frame for your level of under chin fat that you're trying to get rid of. Finally, we're going to talk about dermal fillers. Now with dermal fillers, again, this is only for certain patients, and this is going to be the type of person whereby they've got a lot of heaviness lower down in their face, in the lower third of their face, and the reason they've got heaviness is because they've lost volume from higher up. So in this type of patient, this might be someone in their late 30s, early 40s, they've never kind of considered any treatment before, they've looked in the mirror and they feel like their jawline isn't looking as tight, they're noticing more heaviness under their chin, and they're thinking, what's going on here? This might not even be someone who's typically been concerned about a double chin before, but they're just noticing heaviness in the lower third of their face. For this type of patient, what's going on is they're losing a little bit of volume higher up in the face. When you lose volume higher up in the face, it impacts the lower third. So if you look in the mirror right now and just lift up from these areas here or here and observe what happens to the lower third of your face, you'll actually see by doing this movement here, your jawline tightens overall and there's less heaviness and sagging in the lower third of the face. Likewise, if we directly treat the chin, the chin is an area where we lose bone volume specifically over time. So this loss of bone volume creates laxity, heaviness and jowls in the lower third of the face. And if we restore the bone volume that's been lost, it tightens the area up. So in certain patients who've got a little bit more heaviness in this area due to volume loss, by looking at and addressing areas like the cheek and the chin, we can actually indirectly tighten the jawline, and in some cases this can actually work to help improve a double chin. So to summarise, the lower third of the face, the double chin, the jawline area, it can be quite a tricky area to understand because everyone's needs are going to be a bit different. There are so many things we can do, from dissolving fat, tightening skin, defining and sharpening a structure, and actually pinpointing which one is going to be the best option for you requires a detailed consultation with your doctor. The benefits of some treatments, for example a dermal filler treatment, if it's the right one for you, is that it can be a one-off treatment that you do that's going to last a really long time with an immediate result. Having said that, if it's going to be something more like fat dissolving injections or tightening the skin, this can require multiple sessions over time, and therefore it needs to be planned out for you to have a realistic time frame of when you're hoping for the full and final result to be. I hope you found that useful. If you've got any other questions about double chins or anything else at all, please feel free to leave a comment and we will get back to you.